All right, Nick, myth number 2 for shoulder pain. If you have a rotator cuff tear, you need surgery to fix that. If someone comes into your office and says, yeah, I've been diagnosed with a rotator cuff tear, I need to get surgery, right? That's a common thing that we hear. What would you tell that patient?
I've seen enough patients at this point to realize that that is not true. And I think enough happy patients too, because it's a lot of times it's much easier to uh, go through a rotator cuff tear that you don't have to go through the surgery because it can be pretty extensive recovery afterwards. But no, there's absolutely no reason that you have to. Now, does that mean that everybody's going to necessarily get so lucky where they don't have to have the repair? Well, no, probably not. But there are a lot of circumstances when, okay, it's a partial tear, it's a smaller tear, and we can clean up the mechanics, we can strengthen both the muscle that's maybe partially torn and a lot of the surrounding musculature to really be able to stabilize and have the shoulder joint, the whole shoulder girdle, excuse me, work properly so that there's no further tearing and or that you're able to go no problems.
Yeah, there's a lot of research that shows in asymptomatic shoulders, which just means people that don't have any shoulder pain at all. If you just take an MRI of their shoulder, that if you're over the age of 50, there's a pretty good chance that you're going to have a partial or even, as I was looking at research this morning, a full thickness rotator cuff tear without having any pain and minimal effect in terms of your function. Now, the one thing that I will say in terms of surgery is what are you returning back to? We consider all of our patients athletes. Some are returning to, overhead throwing athletes, and some are just returning to a desk job. So it depends on what function you want to return to. So I have a patient, he's one of my favorite patients. He's got 2 full thickness rotator cuff tears. So he's only got half of his rotator cuff that's left. And when he lifts his arm up, it doesn't look really pretty. And depending on, the position that he's in, sometimes he'll take his other hand and he'll help that up. But he says, Travis, I do everything I want to do. I want to be able to golf. I don't have to lift 50 pounds overhead. I can get around that. So I don't want the surgery. So it really depends
He
on
doesn't have to
who
take
you're
how
treating.
many months off of golfing or doing what he wants to do to have the surgeries.
Yeah, yeah, and no guarantee that it's going to go really well.
Right.
So it depends. There's a lot of different factors that go into it. But really, what we would like to see is, okay, let's fail conservative care. Let's go through a normal course of physical therapy and see what happens. You might be surprised at the results, and if you could, do everything that you want to do and not have any pain and avoid having a surgery, what would be your choice? And most people would pick, yeah, I would just rather not have the surgery. And knowing that it's fairly common for people to have rotator cuff tears. So same thing that we talk about spine arthritis, right? So a lot of people will come in and they'll say, oh, I have severe arthritis in my spine. And it's diagnosed on x-ray or MRI. And that's just part of the normal aging process. You're just going to have a really hard time avoiding that. What is that doing to your function? That becomes the real question. So if you guys want to hear more about and learn more about the shoulder, then I encourage you to go over to robbinspt2west.com/guide, where you can get one of our ultimate guides for shoulder pain. We have a lot of different ultimate guides there that we're coming out with. So all you need to do is go over to that landing page, pick the one that you want, give us your information, and we'll actually send it to you for free. I don't know how long we're doing that for, but for right now, if you're watching this, if you go over there and that landing page is still up, then you're going to get one for free. Just give us your information. We'll send it over to you. Nick had a lot to do with developing these guides. So what kinds of information are going to be in the guide?
So we're going to talk, all the different main diagnoses. So the big things that are going on with the shoulder, they're going to be covered in the guides. And what I mean by that is, okay, what are they? But also the big thing is then what you can do about it. So what are the stretches you can do? What are the exercises that you can do to strengthen it? What are just daily modifications you can kind of make to your life to, hey, these are going to probably have some more bang for your buck than a lot of other changes will. As well as, hey, just some general health tips so that you can get on your way to not only healing the shoulder, but just an overall better quality of life for you.
Yep. So if you have interest in that, head over there, get your ultimate guide, and we'll talk to you guys soon. Thanks, Nick.
Bye, guys.